Hi everyone. Welcome to RSB Healthcare Consulting. 6 things your medical practice needs to know about ACOs. 1. It can be a risk-reward scenario under many programs. Providers also share in the losses when their group fails to meet measured ACO requirements. In the Medicare program, participants can select whether to get involved via a one-sided risk model, sharing in 50% of cost savings realized when caring for Medicare patients, or a two-sided risk model, sharing in 60% of cost savings and/or losses. Before making your practice vulnerable to a financial hit via the two-sided approach, consider whether or not your bottom line can withstand the impact. 2. Your payment model will partly change with their focus more on shared savings and global fees. Joining an ACO is akin to moving one step away from the fee-for-service model, so practices should prepare to adjust their approach to medical billing. But it's also akin to planning for the future. The entire U.S. healthcare system is increasingly moving away from patient volume to patient value, so an ACO can make for a great training ground. 3. You won't practice in a vacuum anymore. Coordinated care under the ACO requirements force practices to enter into new partnerships, and that can be uncomfortable for some physicians. For example, doctors are essentially incentivized to share referrals within the organization, which can feel like abandoning other relationships with a provider's commonly referred colleagues. Be sure to carefully evaluate the partners you plant your flag with, as they'll be crucial to your success or failure with the ACO at large. 4. Timing and location is everything. There's a flip side to the referral situation, as well. If tons of other practices in your area partner up with an ACO but you choose not to, you could be cut out of that ACO's referral network and ultimately lose a portion of your patient base. Be careful how long you hold out, however, because you could get left hanging, and face bad business consequences. Furthermore, if you're in a rural area or small town, you'll need to look well beyond your community's borders for potential ACO partners. An ACO has to manage the healthcare needs of a minimum of 5,000 Medicare beneficiaries for at least 3 years. 5. Governance matters. The leadership and governance of your ACO will dictate the structure of the organization as well as how resources and patients are allocated among participating practices. Make sure you're comfortable with the people and program management, and be certain to carve out a means to have your voice heard in organization-wide discussions. 6. Be prepared to sell. Many large hospitals are buying physician practices to form their own ACOs. If you're approached to sell, get all of the necessary information and make sure that collaborative, value-based care is truly a priority for the organization interested in acquiring you. That means watch out for signs that the entity is just looking to expand its referral base for specialty and hospital services. Thank you for your time. Contact us to collaborate on our email info@rsbhealthcareconsulting.com or our website www.rsbhealthcareconsulting.com.